The complexity and recovery of broken bones, a detailed overview. Broken bones, also known as fractures, are a common medical issue that can range from minor to severe in nature. They can occur as a result of accidents, sports injuries, falls, or underlying medical conditions. The human skeletal system, consisting of 206 bones, serves as the structural framework of the body, providing support, protection, and mobility. When a bone breaks, it disrupts this delicate balance, necessitating a complex process of healing and rehabilitation. In this detailed exploration, we will delve into the intricacies of broken bones, including their types, causes, diagnosis, treatment options, and the remarkable journey of recovery. Types of broken bones. Broken bones come in various forms, each with its unique characteristics and implications for treatment and recovery. The classification of fractures is based on several factors, including the location of the fracture, the degree of displacement, and the pattern of the break. Here are some common types of fractures. Closed fractures. In closed fractures, the bone breaks without piercing the skin. The broken ends of the bone remain within the body. These fractures are generally less prone to infection. Open fractures, also known as compound fractures. Open fractures occur when the broken bone punctures the skin. This type of fracture carries a higher risk of infection due to exposure to external contaminants. Complete fractures. In complete fractures, the bone breaks into two or more separate pieces. This type of fracture often requires surgical intervention for realignment and stabilization. Incomplete fractures. Incomplete fractures occur when the bone is partially cracked but not completely separated. Common examples include green stick fractures in children and hairline fractures. Displaced fractures. Displaced fractures involve a significant shift or misalignment of the broken bone ends. These fractures typically require surgical intervention to restore proper alignment. Non-displaced fractures. Non-displaced fractures involve a break in the bone, but the alignment of the bone ends remains relatively intact. These fractures may be treated with casting or splinting. Comminuted fractures. Comminuted fractures occur when the bone shatters into multiple fragments. These fractures are challenging to treat and often require surgery. Stress fractures. Stress fractures are tiny cracks in the bone that develop over time due to repetitive stress or overuse, often seen in athletes. Pathological fractures. Pathological fractures occur when a weakened bone breaks under normal stress. This can be due to underlying conditions like osteoporosis or bone tumors. Causes of broken bones. Understanding the causes of broken bones is crucial in preventing and managing fractures effectively. Here are some common causes. Trauma. Accidents, such as car crashes, falls, and sports injuries, are leading causes of fractures. The force applied to the bone exceeds its strength, leading to a break. Osteoporosis. Osteoporosis is a medical condition characterized by weakened bones, making them more susceptible to fractures, even with minimal trauma. Overuse and repetitive stress. Activities that place continuous stress on a specific bone, such as running or dancing, can result in stress fractures over time. Pathological conditions. Certain medical conditions, such as bone tumors or infections, can weaken bones and make them more prone to fracture. Age. As people age, their bones naturally become more brittle and less dense, increasing the risk of fractures. Diagnosis of broken bones. The diagnosis of a broken bone involves a combination of clinical assessment, imaging studies, and medical history evaluation. A healthcare provider will typically follow these steps. Clinical examination. The healthcare provider will begin by examining the injured area, assessing for deformity, swelling, tenderness, and loss of function. They will also inquire about the circumstances of the injury and any associated symptoms. X-rays. X-rays are the most common imaging technique used to visualize fractures. They provide detailed images of the bone structure and can help determine the type and extent of the fracture. CT scans. In some cases, especially when complex fractures are suspected or when assessing joints, computed tomography, CT, scans may be used to obtain more detailed images. MRI scans. Magnetic resonance imaging, MRI, scans are helpful for assessing soft tissue damage, ligament injuries, and fractures that may not be visible on X-rays. Bone scans. Bone scans involve injecting a radioactive tracer into the bloodstream to detect areas of increased bone activity. They are particularly useful in identifying stress fractures. Treatment options for broken bones. The treatment of broken bones depends on several factors, including the type and location of the fracture, the patient's age and overall health, and the presence of any associated injuries. Here are some common treatment options. Immobilization. For stable, non-displaced fractures, immobilization with a cast, splint, or brace may be sufficient to allow the bone to heal. This method is often used for fractures of the wrist, forearm, and ankle. Reduction. In cases of displaced fractures, the healthcare provider may need to manually manipulate the bone back into its correct position, a procedure known as reduction. This can be done either closed, externally without surgery, or open, surgically with incisions. Surgery. Surgical intervention is necessary for complex fractures, such as comminuted fractures, open fractures, and fractures involving joints. Surgery may involve the use of screws, plates, pins, or rods to stabilize the bone. Traction. Traction is a technique used to align and stabilize fractured bones, often used in cases of hip fractures or long bone fractures. It involves the application of a pulling force to the bone through weights and pulleys. Medications. Depending on the circumstances, pain management and antibiotics, in the case of open fractures, may be prescribed. Recovery and rehabilitation. Recovery from a broken bone is a dynamic process that involves several stages, and it can vary significantly depending on the individual and the specific fracture. Here is an overview of the recovery and rehabilitation process. Immobilization phase. During the initial stages of healing, the fractured bone is immobilized to allow for the formation of a blood clot and the early stages of bone repair. This phase can last several weeks, depending on the fracture's severity. Remodeling phase. As healing progresses, the body begins to lay down new bone tissue at the fracture site. This process can take several months and involves the gradual strengthening of the bone. Physical therapy. In many cases, physical therapy is a crucial component of the recovery process. Physical therapists work with patients to regain strength, flexibility, and range of motion in the affected limb. Weight-bearing progression. The ability to bear weight on the fractured bone depends on the type and location of the fracture. This is typically determined by the healthcare provider and may require the use of crutches, a walker, or a gradual transition from a cast to a brace. Follow-up imaging. Periodic follow-up imaging, such as X-rays, may be necessary to monitor the progress of healing and ensure that the bone is aligning and strengthening correctly. Pain management. Pain and discomfort are common during the healing process. Healthcare providers may prescribe pain medications or recommend over-the-counter pain relievers. Nutrition. Proper nutrition plays a vital role in bone healing. A diet rich in calcium, vitamin D, and protein can support the recovery process. Complications and long-term effects. While many fractures heal successfully with proper treatment and rehabilitation, there can be complications and long-term effects associated with broken bones. Malunion. Malunion occurs when a fractured bone heals in an incorrect position, leading to deformity or functional impairment. It may require additional surgical intervention to correct. Nonunion. Nonunion is a condition in which the fractured bone fails to heal completely. It may necessitate further surgical procedures, such as bone grafts. Infections. Open fractures, in particular, are at risk of infection. Prompt treatment with antibiotics is essential to prevent or manage infections. Nerve and blood vessel damage. Severe fractures can damage nearby nerves and blood vessels, potentially leading to long-term sensory or circulation problems. Conclusion. Broken bones are a common and often challenging medical issue. Understanding the types, causes, diagnosis, and treatment options for fractures is crucial for both healthcare professionals and the general public. The journey of recovery from a broken bone is a complex and dynamic process that requires patience, diligence, and expert medical care. With the right treatment and rehabilitation, many individuals can regain full function and mobility, allowing them to return to their normal activities and quality of life.